YouTube channel. My name is Russell Hardy. I'm the chair of South Warwickshire University NHS Foundation Trust and chair of the Council of Governors, and I'm delighted to be hosting this digital hustings tonight for the 3 available positions for West Stratford and Borders. We have 5 candidates who are putting their names forward, and in the detail which is available to you in their nomination statements, you'll have been able to get a degree of background on each of the candidates. The format of tonight will be I will introduce each of the candidates, and then they have up to 5 minutes to introduce themselves. And at the end of all of the candidates having done so, I will invite any members of the public to ask questions. If you'd prefer, you can use the chat box facility to ask those questions, and I can ask them on your behalf. The choice is yours. And at the end of the meeting, Sarah Collette, the Trust Secretary, will outline the timetable of events from here. So, as I said, welcome particularly to members of the public and to candidates. So first up is Paul Bowness. I can't see the details of some people's names on the screen. Is Paul Bowness with us? Okay, well, we'll maybe come back to Paul if he joins us a bit later. Is Tim Cook with us? Tim, so over to you. Nice to meet you.
Thank you, Chairman. Could everybody hear me okay?
Yes, we can.
Right. Good evening, everybody. I'm Dr. Tim Cook, and I'm standing for the first time as a potential trust governor. I'm now retired from full-time general practice, although I'm still doing a small amount of work. And as you could see in my submission statement, I've been working in South Warwickshire healthcare now for, I think, 36 years. Both within the trust for a considerable portion of the time and in primary care. When I joined the local healthcare system 36 years ago, we were operating on 3 full district general hospitals at Stratford, Warwick and the Warnford. And I've seen the evolution that's taken place to the foundation trust we have today. I think the trust has a great reputation locally and a lot of support from our local population. And I think virtually without exception, all the people living in South Warwickshire would love to have all their healthcare delivered to them in South Warwickshire. As over the years, any time when I've mentioned to patients that they might have to travel outside the area to have treatment, they're always disappointed. And I'd be keen to support that going forwards. I accept the fact that Warwick is not a tertiary level hospital. There are obviously some services that have to be delivered elsewhere, but I think people's real preference would be to stay local if possible. I've not been in the role of a governor before. And so I was having a think about the potential challenges our trust might face going forwards. And the first thing that occurred to me was we're dealing with a growing population in South Warwickshire, only to get considerably larger with the potential housing effects on our local plan. We're dealing with an ageing demographic of population. And it's extremely important that we're well integrated with social care to deliver joined up working. And we're dealing with an increasing burden of chronic disease as well. And there's all challenges going forwards. We're all living longer, new treatments are arriving, new methods of delivery. We've also, any healthcare trust is going to have to cope with and comply with whatever comes down from central government in terms of future directives and targets. And I think one of the main public perceptions of the trust is our front door, our A&E department. And I think, I mean, I know I've listened to previous governor presentations. I gather various work has been done on that already, but it's certainly our window to the public. And I think experiences can be a little variable there. I think recruitment and retention of our staff is a major issue, both medical, nursing, and all other disciplines. As we all know in all organisations, that if you don't work in a happy environment, you tend to leave, and recruitment can become difficult. And I think it's really important that we look after our staff really well. I think joined up care is going to be key going forwards, and I know there are some great success stories locally with this. I mean, one thing that comes to mind has been our joint replacement service, where patients are spending very small periods of time in hospital, followed up by fantastic early community care, which is, I think there's a great success story both in secondary and primary care. And the other project that I was involved with as well while I was working full time was called a Discharge to Assess project, where basically patients having had a medical episode of some sort completed at the trust, instead of having to stay in the acute hospital at great cost and at risk of acquiring all sorts of other hospital problems, are able to be assessed in the community in nursing homes as a halfway house heading hopefully towards home or more permanent placement. So those are just a few things that I have come to mind as potential issues going forward for the trust. But as I say, I've been new to the governor's role myself. Thank you very much, Chair.
Thank you, Tim. So we'll move on then, as Paul hasn't joined us, and I will introduce Mike Flaxman. Mike, over to you.
Thank you, Russell. All hear me okay? Yep. Rather different focus. I'm not a clinician, so I won't be straying into medical issues. But first, I'd like to thank the members of the Foundation Trust that have found the time to sign on today to listen to the governor candidates explain or expand on their election statements. My own election statement set out some details of my association with the NHS, which has covered nearly 50 years in a varied number of roles, including 15 years as a Director of Finance and Information Technology, and also as a non-executive director of a foundation trust previously. I joined the Council of Governors in 2022. Very much enjoyed my association with SWFT, which I would very much like to continue if I'm elected. I'm very familiar with all the challenges faced by the trust, so I'm not going to go into those in any particular detail. Being retired from paid work, although I don't seem to do much less these days, I have the time to dedicate to my goals of the continuous maintenance and improvement of health services in South Warwickshire, and very importantly, ensuring that the trust engages with public and patients in South Warwickshire and that the Foundation Trust is properly governed. I'm currently supporting the development and updating of the Trust Public Engagement Strategy, which will set out how the Trust intends to keep the full constituency updated on the plans and proposals for service provision. This will become even more important as we see how the NHS reacts locally and nationally to the new 10-year plan to be published in April. Keeping up with government pronouncements, which are pretty frequent at the moment, seems pretty much a full-time job, and I don't at all envy the trust directors who have to respond to all of this. I've also been a board director of Healthwatch Warwickshire since it was set up in 2013. The goal and duty of Healthwatch is to ensure that the patient's voice is heard by the NHS, in particular those who are seldom heard and listened to. This extends to the whole of Warwickshire and to other service providers who provide services to South Warwickshire residents. The role at Healthwatch is one of an evidence-based critical friend to the health service, and this experience with Healthwatch underpins my personal goal of ensuring that engagement by the Trust is wide and purposeful. In the 2 years since joining, I have at times pressed the non-executive directors and the chairman on matters of finance, accounting and estate strategy. As well as my early background in NHS finance, for about 25 years up to 2020, I was involved in the development of many NHS facilities, from local health centres up to very, very large acute hospitals. For this reason, I was asked to be involved in the project board for the Stratford Hospital Community Diagnostic Centre, which will open in summer this year. I have tried to ensure that this well-managed development does not cause issues for patients and visitors, and that there is continuity of service for the Stratford population. I believe that the role of public governors is fundamental to ensuring that the Foundation Trust is properly governed and meets the needs of the population. As a public governor, I would continue to represent the local community. Having lived in the area for 30 years now, and with my NHS background, I have the skills and attributes to be a public governor and to help SWFT to maintain the excellent service levels currently provided. Thank you.
Thank you, Mike. And we'll move on now to Roger Lloyd. Roger, over to you.
Hello, my name is Roger Lloyd, and I'm seeking your vote to re-elect me as a public governor for West Stratford and Borders. I and my family have lived in this constituency since 1976, and we've used Warwick Hospital many times, having treatment for cancer and heart failure. Now that I'm retired from the position of a local authority senior lawyer, I have the time and the energy to give back to the hospital and to assist them in securing the best services for the community. Being retired allows me the time to devote to being a governor, which can be quite demanding at times. Attending committees or working groups after reading the papers, and then preparing a report on that meeting and presenting it at the next Council of Governments probably takes between 2 and 3 hours. Reading the board papers, about an average of 275 to 300 pages, and then observing the meeting, which is a monthly event, is usually another 4 to 5 hours. So being a governor and doing justice to the role is time consuming. However, I enjoy it and have the time to devote to it. This aspect of the role of governor is not attractive to all, and each governor brings their working life knowledge and experience to the role. The Trust needs all types of skills, whether personal or knowledge and governance-based, to cover all aspects of the business of running a very complex organisation. Diversity, both in cultural and life experience terms, is needed in governors, primarily so as to effectively monitor the non-executive directors. You need to know the subject to understand whether the right questions are being asked of the executive team and whether the answers are the most appropriate. The Trust is very complex, with a wide range of constraints, and governors can help it continue its path to excellence in service delivery for the community at large. 2025 will be a very important year for the Trust in many ways, but in particular in relation to the position of the chair of the Trust. Russell Hardy, our current chair, must relinquish his post in the spring of 2026, and it is therefore important that SWFT starts the process of finding a suitable replacement early in 2025, as the power of appointment rests with the Council of Governors in consultation with others. The complexity is that Russell is also chair of 3 other trusts in the foundation group, where the power of appointment rests with NHSE, and the future of the foundation group rests on the net effect of these appointments. As chair of the Nominations and Remuneration Committee for the last 3 years, in fact, I think it's 6, I'm very aware of the conflicting pressures involved, and with your help to re-elect me, I hope to be able to bring the benefits of my recent experience as chair to assist SWFT in these difficult decisions. Thank you for listening to me.
Thank you, Roger, and thank you, Tim, and thank you, Mike. Paul Bowness still hasn't joined the call, and Colin Richardson is unable to attend. Both Paul and Colin's statements of candidature are available, as I mentioned earlier. I can't see any questions in the chat box, but would any members of the public who are online like to ask the candidates any questions? Bob Malloy?
Yes, please. First of all, thank you very much for arranging this. It's very useful to meet the candidates prior to voting. I'm making the assumption that the role of the governor means more than giving their own opinion at governors' meetings, but hopefully representing the views of the areas that they're elected to. So I just wanted to ask the candidates what community connections they have, and what mechanisms they might use in order to be able to say that representing more than their own view, but representing those of patients and potential patients in their areas, if that makes sense.
It does, Bob. Thank you very much. So I'll come to Tim first, and then I'll go to Mike and then to Roger. That will be the order we'll answer the questions in. So, Tim, how would you answer Bob's question?
Thanks, Bob. Standing as governor for potential governor in West Stratford, I live in West Stratford. I'm involved with, in addition to my GP work, which I've been here for many years, I'm involved with our local, effectively parish council. I live in Tiddington, involved with the Residents Association there. I think my experiences, I've had quite a lot of experience as a patient myself, both at Warwick and at UHCW. And I think I've seen it from both ends, and I can see the upsides and the downsides and the difficulty, and I've seen the full patient journey that people have to make from primary care to secondary care and back again. I think all of that I would find would possibly be a positive contribution to being governor.
Thank you, Tim. Paul Bowness has just joined us. So what I'm going to do is to pause the questions. I will come back to your question, Bob, but I'll invite all the candidates to answer it. Paul Bowness, we've obviously been running in your absence with the other candidates, but do you want to introduce yourself to members of the public for up to 5 minutes, please?
Yes, thank you. I hope you can hear me. I had great trouble logging in.
No, we can hear you, Paul, so over to you. Right.
Well, I won't obviously go through the statement I submitted when I put myself forward. Just to say that I've been moved to put my name forward because I've been receiving treatment for a number of eye disorders at both Stratford and Warwick hospitals for a number of years now, and I'd like to make a constructive contribution to healthcare in the area if I can. I should point out I am retired. I was a translator and interpreter, so I can devote my time to the governorship should I win the election, should I be made a governor. I don't hold any other offices in comparable bodies. My particular concern and one I would seek to address if I was elected, is the seeming lack of communication between different entities of healthcare in the Stratford and Warwick areas. For example, in the matter of eye care, which is where I have most experience as a patient, Stratford and Warwick have an eye unit, the same eye unit in fact, but there also operates a community eye hub in Stratford, and they don't know anything about the eye unit, and the eye unit doesn't seem to know anything about them. I was referred over there once for urgent treatment, which I couldn't have because they didn't know anything about me, and was then sent to Coventry to have the treatment. They could not access my records because each trust is self-contained in that department, and I really think that's something we need to address in the health service in general. I also think in general terms that we should be putting more emphasis on prevention, not cure. For example, continuing to discourage smoking, try to get obesity levels down. This would relieve the burden on the NHS. I think it's something, and get people to take more personal responsibility for their health, not expecting the NHS to pick up the pieces when something goes wrong, and people shouldn't really go running off to A&E for tiny little things that they could deal with either themselves or through a pharmacist. And that's something I think we're going to have to address because of the increasing age of the population and indeed the increasing size of the population. I don't think we can go on completely as we are. Thank you. That's all I really wanted to say.
Okay, thank you, Paul. Paul, Bob, I hope I do your question justice, but Bob's question, Paul, which I'll come to you at the end after I've gone to Mike and Roger, was about how you would ensure that you were able to effectively represent the view of the public when fulfilling your role as a governor, and what mechanisms you would use to ensure that you were able to represent members of the public effectively. So, Mike, how would you answer Bob's question, please?
Oh, in a fairly complex way, actually. I've got probably 4 tiers of input and output in terms of patient and public issues with the health service. In terms of understanding what patient and public concerns are with the health service, I've probably got 4 routes in and out. One, which is fairly minor, where I chair the parish council and do hear a bit about the health service, not an enormous amount, but whatever I pick up does go back in. I'm on the patient participation group at Bidford Health Centre, which is very busy, about 15,000 patient population. So I pick up quite a lot from the PPG meetings as well and bring those back and get those fed in. I represent the PPG and Bidford Health Centre at meetings of the South Warwickshire Patient Engagement Forum, which is a meeting of all of the patient participation group leads in South Warwickshire. About 35 groups of people are invited to that. We usually get in excess of 20 present at the meetings. We get a lot of information flowing through that meeting. And recently I picked up a query on the issue of the design of the patient portal from another PPG representative, which I took back to the trust to ask how they might deal with it and how they might improve the quality of the patient portal in terms of information for patients. And I have to say I got a very, very thorough response from Innovate Clinical Systems on that particular query. I'm also, as you know, the board director of Health Watch Warwickshire, water, hang on. Where,
as long as it's not gin, Mike, we're okay.
You've got my little secret, Russell. As a board director of Health Watch Warwickshire, I see all of our surveys that we carry out, and we often carry out surveys for seldom heard groups, and the information that we get back from those provides us with a lot of background. in terms of what's wrong with the health service and actually what's good with the health service. I mean, Healthwatch pitched up a lot of compliments for the South Warwickshire Foundation Trust services, and I think in some ways we see more compliments than we'd expect, and that is a good sign that the trust is actually doing pretty well. But as I say, I've probably got 4 different routes for processing patient information and feeding it back into the system, Bob.
Thank you, Mike. And Roger, how would you answer Bob's question?
Thank you. I think my primary route to finding out what the general community is thinking and saying and wanting to discuss is entirely through my neighbours, my local area, where I am known to be a governor, and people frequently come to me indicating that they've had X issue or Y issue, or indeed giving compliments for excellent treatment that SWFT has delivered to them. So that is well known, and bearing in mind that I have lived in this area for 50 years, there's an awful lot of people that know of me in this role. I'm also a member of the Bidford Patient Participation Group, and find that there is a lot of useful information, items that are raised or discussed. And although Mike Flaxman and I are both on the same group, we tend to spark off different aspects of the agenda there. So from that point of view, he might go off on one particular aspect, and I go off on a different one, still arising out of that same meeting. So there is a fair amount of information. I also, unfortunately, have been bumping into quite a lot of patients in Warwick and Stratford when I have been there as an outpatient or accompanying my wife with outpatient appointments. So I keep on asking questions there and seeing just what people are feeling and how they are coming forward with comments, criticisms, and in many cases, absolute delight at the quality of the service they're being given. It's not perfect. A&E is a very difficult time, and having spent 36 hours in it relatively recently in January, I know about it. But these are the sorts of things that all feed back and give you a patient perspective, a community perspective, which the trust needs to hear.
Thank you, Roger. And Paul, how would you answer Bob's question?
Well, what I hear comes mainly from my neighbours and people I encounter really by chance. I live in a part of Stratford where we have a very high proportion of elderly people, the road I live in, and they do tell me things, although I must say I've not heard anything negative from them about local health services. Everybody's quite positive about Stratford and Warwick hospitals, and I think that's something to be grateful for. I also I'm a member of the local rail user group, and I used to be a committee member there, and had to listen to criticism of rail services, nothing to do with health services, of course. So one point I do think of which I think we need to be conscious is with older people, the lack of IT skills. I experienced that myself. computer literacy tends to decrease the older you get. No offence to anybody who takes a different view, but I think we are becoming increasingly reliant on information technology, and people who haven't grown up with IT are at something of a disadvantage. So I think I would like to address that in any way that it could be addressed. That's it, really. That's all I can say about the matter. I think I've been very fortunate in not hearing a lot of negative feedback.
Thank you, Paul.
A lot of positive feedback.
Thank you.
Right.
Elizabeth, what would you like to ask the candidates?
Thanks, Russell. So my interest, in case any of you don't know, is inclusion and accessibility. And just hearing what Paul said about digital stuff, I know that the Trust works really hard on inclusion because they've always got me reminding them. I've worked as a volunteer supporting the Trust. I'm always there reminding the thing, and the governors reminding them things that need to be done and what needs doing for inclusion. Happy to do that as well and continue doing it because I've got the skill. I'm always a bit perturbed when people repeat what I say and then turn it around and do it slightly differently. But the Trust is very aware that it's about 14% of the population are not connected to devices, the need to offer alternative. So I'm reasonably happy about that. What does concern me is that sometimes at base level things get overlooked. And a great example of this is when they started the plans for the CDC at Stratford, they didn't put any toilets in. They were relying on the single toilets in use for the Lomas Cafe. They thought that they would do the whole of the CDC. And it was only when I actually jumped in. Now, that's the sort of thing that needs doing, not by me, the willing volunteer, that needs doing somewhere else along the line and picking up. So I'd like to see, but if people haven't got that skill, then don't be frightened to ask for information, but there just sometimes there are things still slightly overlooked, and that's the governors just need to be aware of that. Thank you.
No, thank you, Elizabeth. Would you like to, Elizabeth, just on this public forum, we benefit as a Trust enormously from your input. Elizabeth and I, not as regularly as I would like, take tours of the Trust where she bends my ear on things that aren't being done properly, which is incredibly valuable. But is there any question you would like to ask the candidates, Elizabeth?
No, probably not, because I wouldn't want them, I don't expect them to have the skills that perhaps I've acquired over 30 odd years, and that's where they've come from. But I would like them to think that they need to not be frightened to ask if they don't know. Not assume that they do know and turn up at meetings assuming all is okay. I said that about the Lomas Suite toilet because I was mortified when I knew there weren't going to be extra. They thought they could manage with the existing toilets. Well, that was never going to happen. So no, thanks for asking. I haven't got a question for them, sorry, but I just wanted them to know that they do need to be inclusive.
No, absolutely. Thank you, Elizabeth. Tim, I'll come back to you in just a sec, if I may. I just want to keep it with members of the public at the moment. So any other questions from members of the public? Okay, any sort of concluding comments from candidates? You first, Tim? Are you on mute, my friend?
Sorry, there we go. I'd just like to say thank you very much for that, Elizabeth. I think I'm possibly partly trained by yourself over all the years of the patient participation group at Rotherhouse Surgery. So you are an ongoing source of great wisdom in that area. Thank you.
Thank you, Tim. Mike, any concluding comments from you?
Yeah, I've known Elizabeth for quite a while. One excuse and one comment. The excuse is that I joined the CDC project board after the design was finalised, so I wasn't involved in the early discussions. But Elizabeth knows my background. I mean, accessibility physical accessibility is something I've been extremely involved in all of the capital projects I've worked on over the last 20 years. And in particular, in one example at Barking Community Hospital, we developed what we called the yellow brick road, which was actually yellow paving around the outside of the building to allow partially sighted people to find their way in. It was a very interesting exercise. But I know Elizabeth and I have talked about accessibility on various occasions. Thanks, Russell. And thanks for the opportunity to put our thoughts across today. Very useful.
And Roger, any concluding remarks from you?
Just one for Elizabeth. We're both on the wayfinding strategy group, and she may remember that I keep on harping on about the ability of people without digital devices to actually be able to navigate whatever system we end up installing. So that's I do try and raise these issues when I know that she hasn't already banged it on the table.
No, thank you, Roger. And
Thank
Paul,
you.
any concluding remarks from you? Paul, you're on mute if you do want to say anything. Otherwise, if not, no worries.
I do think accessibility is a very important issue. I talked about digital inclusion earlier, but physical accessibility is something important. I think as well, from what I can see in local healthcare facilities, we're getting a lot of it right. Also, I've been very involved, as I said, with rail user groups, and I know Elizabeth Dixon has as well. And the rail user group has pushed hard for improved access at local railway stations. So yeah, I am very keen on accessibility, both physical and digital. Thank you.
Thank you. Thank you, Paul. So I'll draw a close then, if there are no other questions from members of the public, to the formal bit of the meeting. Thanking again Tim, Mike, Roger and Paul for their contributions and statements. As we said, each of the candidate statements for the 5 candidates standing for the 3 seats are available and available online. But Sarah, just describe the process from here, please.
Thank you. So the voting stage closes at 5 o'clock on Thursday, the 13th of February, and then the results will be declared on Friday, the 14th.
Valentine's Day for those of us who are romantic bent. So thank you very much for your time this evening. Bob, thank you for your question. Elizabeth, thank you for your statement. And again, candidates, thank you for standing for the role. It is an incredibly important part of the governance structure of us as a foundation trust, and the Council of Governors has been absolutely a cornerstone of ensuring the focus on patient care has been at the forefront of everyone's thinking over the last decade. So thank you. Take care, everyone. Have a nice evening, and I look forward to seeing you in due course. Take care.